A very good evening. A very good evening to all of you. Sparsh Tomar and myself, Manasi Mahajan, we are presenting this PPT on male and female hormonal disorders. Before we move ahead, we would like to give a heartfelt gratitude to all the acharyas who have given us so much knowledge, to our parents, to Nutan ma'am for teaching us Garbha Sanskar in such a simple and beautiful manner, to all the teachers of the AYG Academy, and to all of you here in our class who asked so many questions and queries that our knowledge increased manyfold. So thank you. So let's start about male and female hormonal disorders. Now, what are hormones? Hormones are basically body's chemical messengers sending signals into the bloodstream and tissues. They affect different processes, including growth, development, metabolism, and reproduction. Now, reasons for hormonal disorders, there could be many reasons specific to a disorder, but the generalized reasons could be unhealthy diet, excessive body weight, sedentary lifestyle, some hereditary reasons, or injury to the endocrine glands. And symptoms of hormonal disorders, again, could be specific to the disorder, but the common symptoms would be fatigue, gain or loss of weight, depression, and anxiety. So today, due to time constraint, we have taken 5 hormonal disorders or imbalances like low testosterone, diabetes, thyroid, PCOD, and cortisol imbalance. So let's start with low testosterone. If there is a problem or imbalance in the earth element, then low testosterone can happen. The pituitary gland, if it secretes less LH and FS hormones, then there is a problem in the functioning of the pituitary gland, and the testosterone in the sperm count is less. So metabolic disorders or chemotherapy for cancer or injury to the testes could be the reason for that. Now, the symptoms of this disorder is delayed puberty, absence of menstruation, depression, and low sex drive. Over to you, Sparsh.
Yes, thank you, Manasi ji. Now, what are the yogic practices that we can do for the low testosterone? And according to Yogi Swatmaram ji in Hat Pradipika, they said first we have to cleanse the body. First, so to cleanse the body, they told about us the Satakriya. What are the Satakriya that we can do for the to cope up with the low testosterone is the Trataka. Even we can know about this, everyone. The Kapalbhati and the Sang Prakshalan. Sang Prakshalan is the you can clean your whole body like colon clean. The second that you can do is the Surya Namaskara. Surya Namaskara include the 12 postures. The Brahmani, what are the best pranayam that we can do is the Brahmari, Nadi Shodhan, and Shitali. And the bandhas for the best bandhas for the to cope up with the low testosterone is the Mool Bandha. Why Mool Bandha? Because already the earth element is a little bit imbalanced if we are facing the low testosterone movement. So to cope up and to again activate the testosterone, we need to activate the Mool Bandha, which will help us. And again with this, we can do also the 2 Kriya. First one is the Mahamudra Kriya, and second one is the Viprita Karni Mudra. That is told by the Yogi Swatmaram. And the asanas that we can do is the Garudasana, all the inverted pose, and all the meditative pose. Yes.
So now let's move on to the next hormonal disorder, which is diabetes. If there is an imbalance in the fire and air element, then it could lead to diabetes. Insufficient production of insulin by the pancreas is the main reason why a person suffers from this. The causes could be excessive weight, inactivity, family history, and stress. Actually, there are many causes, but we have just combined a few here. The symptoms could be excessive thirst or excessive urination, weight loss, fatigue, and blurred vision.
Yes. Yes. Now again, to cope with the diabetes, you can see the fire and the air element is imbalanced, and to heal the fire and air element, the first set kriya to cleanse the body that we can do is the dhoti, that you have to suck in the dhoti and just remove it out, so it will get all the kapha out. The second set kriya is the Kapalbhati, and third one is the Vaman. And after sat kriya, we will do the asana, all the twisting pose, all the prone posture, all the prone asanas are very beneficial for the pancreas gland. After the asana, we can do the pranayam. The pranayam is the Bhastrika and the Nadi Shodhan. After the pranayama, we can do the bandhas. The Udyan bandha is best to like little bit massage all the internal organs, abdominal organs. And the last one is the kriya. After doing all of this, then we can do, according to Ghiran Samhita, they say the Agnisara kriya and the Noli kriya is the best to release all the poisons from the abdominal cavity, even from the pancreas and the liver and everything. Yes.
The next hormonal imbalance that we are going to see is hypothyroidism. It is due to the water element imbalance. Low production of thyroid by the thyroid gland is responsible for this. In this, the symptoms could be fatigue, lethargy, weight gain, irregular periods, or hair loss. Nowadays, due to increased stress and strain, a lot of people are going through this problem. And it also happens that as you age, the thyroid problem can aggravate. So it's better to be on yoga even when you are very young. Harsh?
Yes, and as it explained, the water element is imbalanced. So we will include all those practices which will which will balance the water element. So what are those practices that is told by all the scriptures in the Gerenda, Hatha, Shiva? That the first thing is the Satkriya. We will go through the Satkriya to cleanse the body, as I told earlier. The first one is the Vamana. It means like you have to drink the water and then again you have to vomit it. So it will cleanse the whole passage through the esophagus and the thyroid region. The second one is the Kapalbhati. Kapalbhati is one of the practices that will activate your thyroid, even the Anahat chakra, your Visuddhi chakra, and the Agnya chakra. The second is the asanas. What are the asanas that mainly that will activate or will work on your neck? So the Halasan ho gaya, Sarvangasana ho gaya, Matsyasan, Marsipyasana, and the Setubandh asana that we can do. The next one is the pranayama. Even everyone knows the Ujjayi. Ujjayi will activate the thyroid region. The Nadi Shodhan and the Brahmi. We will include Brahmi in each of the hormonal imbalance because it works mainly on the brain and mainly on the pituitary gland. And the kriya that we can do is the Kapol Shakti Vikas and the Viparita Karni Mudra that is in the Hatyo Pradipika. Yes, Mansi.
The next hormonal disorder is polycystic ovary syndrome or PCOS. It is the higher level of male hormones called androgens. If they are present in the ovary, then the releasing of eggs or ovulation is irregular, and then you can have irregular menstrual cycles. So the symptoms of this are absence of menstruation, abnormal menstruation, dark patches on the skin, unwanted hair growth, and weight gain. Now, PCOS is on a rampage right now. A lot of girls are facing this problem. And not only is it affecting the physical nature of the girl, but also it is affecting her mentally because of increase in weight or unwanted hair growth. The person is feeling very low on self-esteem. So polycystic ovary syndrome has to be treated ASAP. Yogic
Yes.
management.
Yes, for the polycystic ovary syndrome, the main element which get imbalance is due to the water element. So we will include for the yogic management for the water element, as I told, first we have to go to the Satkriya, asanas, then pranayam, then mandas, and last one is the kriya that will include all the mudras. So the Satkriya basically is the Kapalbhati and the Trataka. Asanas, all the hip opening posture like Malasan, Bhadrasan, Konasan, Setu Bandhasan, Pavan Muktasan, and Ardha Halashan we can include. The pranayam is the basic Nadi Shodhan and Brahmi, as I said earlier, the Ujjayi, and mainly for this is the Shitkari. And the mudras is the Sambhavi Mudra and the Viparit Karni Mudra that we can do. Yes.
And lastly, we come to the cortisol imbalance or the stress hormone. It is caused by the disorders of the adrenal gland. Now, symptoms of cortisol imbalance is fatty deposits between the shoulder blade muscles, weakness in the upper arms and the thighs, memory and concentration problems, bone loss, and type 2 diabetes. And the yogic management would include?
Yes. And the earth element is related to the stability and the stable mind. And due to the imbalance of the cortisol, that is stress hormone, we are not stable either through the body or either through the mind. So the yogic management will include all those postures which will make more stable and relaxed. So the Satkriya is the Trataka, Jalaniti, Sutraniti. For the first time that I'm including the Jalaniti and Sutraniti, Kapalbhati and Trataka. Asanas are all the meditative asana pose relaxative asanas, and the forward bending asanas, because the blood will go toward the head. And the pranayam, the most common, the Nadi Shodhan and the Brahmari. This time I will include the Shitli, Shitkari, and the Bhastrika. And the best mudra that is told by the Swatmaram is the Mahamudra and the Viprit Karni Mudra. And the last one is the Bij Mantra. As you can see, the each and every chakra is related to the each and every like pituitary, like the glands. Like even we can see that we can chant a particular Bij Mantra if it is related to any kind of imbalance of the hormones. Like if we can talk about the pancreas, then we can chant the mantra Ram. If it is related to the thyroid problem, we can chant the Hum. And through this Bij Mantra, we can cure the problem. And the best mantra that is Shiv Puran said that you can heal any kind of disease through this mantra, that is Om, because it will activate your Vishnu Granthi, Brahma Granthi, and Rudra Granthi, and that include your all the glands, endocrine glands. Thank you very much.
Thank you so much. We have come to the end of our presentation. Before we finish, ma'am, I would just like to thank you for this wonderful experience of Garva Sanskar. When I joined in, I had joined in for the practical knowledge, for all the theoretical things, but I feel I learned much, much more from you. And the things like the Rudra and everything that you taught us has really impacted us in a very beautiful manner. So thank you for this course.
Yes.
Most welcome.
Thank you so much, ma'am. Thank you so much, because whatever I have learned is everything is new for me, because I have never seen. मैं कभी सोच नहीं सकता था कि इतनी डीप और इतनी लिटरली इतनी डीप हो सकती है ये फीमेल बॉडी. But after this whole session, I like it's so much deep. गर्भ संस्कार इतना deep हो सकता था. I never ever imagined. Thank you so much. Thank you so much.
Thank you so much. Very nice presentation, and communication between two is really good. We can literally feel again, energized.
Thank you, ma'am.
Yeah.
Thank you.
Okay, just close your presentation. PPT close kar dena.